I am one of your hosts, Ebony White. I am the Community Outreach Coordinator with Reach Initiative in the African American Health Equity Task Force. I am delighted to be with you, and I want to really let you know who my co-host is on today and will be with me for various weeks because we will be with you on WDAP bi-weekly on Mondays at 6 p.m. So enough about that. Everyone, I want to introduce you to Stan Martin, Stan the Man Martin, as a matter of fact.
Yes. How you doing, my friend? How you doing?
I'm good.
Good. It's good to see you. It's great to be here. For those of you who I haven't had the pleasure, of meeting, I'd just like to say, give a shout out. Once again, to Stan the Man Martin, Buffalo's son, Buffalo's favorite son. I'm gonna go ahead and put that claim to fame on myself, from the Queen City. So. Just happy to be here. I'm looking forward, just having some real talk, some real conversation with you and also our listeners today.
For sure. So, Stan, I think this is a perfect segue for people to really know what Reach is all about. Reach Talk, what they should expect from us, what they're going to hear when they listen in those 30 minutes. But I'm going to encourage you, when you get ready to sit down at 6 o'clock and tune in to us on Monday nights, get a paper and pen, because we're going to always leave you with a wealth of knowledge and things to talk about in your own living rooms. So, Stan, let's share what Reach is all about.
Sure. Let's just start back. Let's just take it back, utilizing the Sankofa principles from where it all started from. Reach is a project of CAI, or Chickatelli and Associates, and we're actually received the grant from the CDC as a result of our partnership, our application with the African American Health Equity Task Force, as well as I'm going to give a shout out to the Buffalo Center for Health Equity. And it's because of that partnership, it's because of that rich relationship that we were able to acquire the REACH grant, which stands for Racial and Ethnic Approaches Towards Community Health, to really address the health disparities amongst, believe it or not, African Americans, those who identify with the Black diaspora, here in the city of Buffalo, across 5 zip codes, the 14208, 209, 211, 213, and 215. So, we're actually in year 3 of a 5-year grant, and our focus, our strategies are on several different categories. And, certainly, Ebony, you've been instrumental in the implementation of them. One of the strategies of focus is increasing access to fresh fruits and vegetables, food and nutrition. When we look at some of the food deserts, that we reside in our community, how do we utilize the assets, the resources in our community to make sure that, residents have access, to healthy foods and healthy nutrition. And we also provide awareness and education on that same line in terms of the importance of breastfeeding. When oftentimes we think about nutrition or we think about early development, in our community, that's something that, is very important and that we want to raise awareness and education on, because those are those formative years, those developmental years, in the brain, that are so important, for, one's maturation throughout one's life cycle. In addition, another focus area that we have that we spend a lot of time on is on community and clinical linkages. Quickly, when you look at the historical trauma, that communities of color, and the distrust that we have, with physicians, with clinical providers, how do we heal? How do we, build those safe, supportive environments where so we can have, those conversations with our healthcare providers or professionals, other professionals, to increase adherence. And last but not least, we promote, tobacco-free living, tobacco-free lifestyles. So it's really looking at how do we prevent the initiation of tobacco use. We know that historically the tobacco industry has, heavily marketed their products when used as intended will kill you, all right, amongst communities of color, in particular menthol cigarettes. Also, raising awareness about the harmful impact or effects of secondhand smoke. People aren't aware that, just because they might not be, smoking a cigarette, but they still can be impacted by, the secondhand smoke as well. A lot of people have went to the doctor and found out, different diagnoses. And they're like, well, I never smoked a day in my life. Well, have you been in an environment, whether it was work or whether it was at home, all right, that, you've been exposed to secondhand smoke. And that's one way of entry point. And Also encouraging those who want to quit. We work very closely with the Quit Line, to promote tobacco cessation efforts. Not everyone can quit cold turkey. Sometimes you need some additional help, counseling, or just coaching. So we leverage our relationships in that area. And I think this to bring it all home, Ebony, what we're probably going to be talking about today, I would imagine, is what's impacting our society. And that's COVID, and flu vaccination. So working very closely with you, to, really increase awareness and education surrounding those areas. And one last piece is diabetes management, which you've been instrumental. So thank you for improving our relationships with local physicians and making sure that we don't have that disparity, or at least we're addressing that disparity and creating access pathways to those services.
Now, so we are so Stan and I are so accustomed to always being guests that we said, you know what? Did you see what he just like spewed off and like shared all that info in like 4 minutes? That is not a 4 minute. We can't take care of all of this and fix it all in 4 minutes, right? But that is all that his work embodies all of that. So we said, you know what? We've always been guests. We're going to be some hosts, right, and create the space for our community members to get on, listen, learn, see who our partners are. So today you just get to see 2 of us. Mm-hmm. But you'll also possibly see very soon Samantha Nephew will be with us as well, or interchangeable, but we come with a wealth of knowledge, right? We come with this knowledge, and we'll be bringing on our partners along with Ruthie Lloyd as well in dealing with nutrition. So it's a great opportunity for us to really have conversations and not just like quick shots, if you will, of what we're doing and it's just flashing by you. We want to talk about it. We want to talk through it. So I'm excited about this. So today, as he mentioned, we're going to talk about COVID-19, the vaccination, and the confidence that our community members have in it or don't have in it. So we're going to tackle that in our own way right here. So Stan, I'm going to ask you, what's the word on the street?
Well, the word on the street is that I'm not taking it. I'm not going to get vaccinated. They're trying to dupe us. They're trying to like kill us. I'm gonna get sick from it. And just some other things that I'm sure that we all have heard. And I think one of the things that is very important that we try to get across and share with folks is that it's better to have some protection than no protection. Because this thing is evolving, this thing is changing. And we're faced with this, the Delta, variant.
Right. Just to add to, something, another layer, add to. Already, people are not ready to make a decision about taking the vaccination now. But now here's something else. And on top of that, we still address flu. So some of you may have seen Stan and I when we last year and previously just discussing the flu vaccination. Mm-hmm. People were absolutely, and flu has been around for how many years?
Ooh, thank you.
A long time, right? A long time. People still are adherent or not, really are oppositional to the flu vaccine. I don't want that either. And that's something that visits us every season and shows up in a different form from time to time. And what we do, and scientists preparing for it, is try to give us the very best protection against it. So I'll share. So I've had the opportunity to have some listening sessions, Stan, and some of the things that came out was how people interpret the word shot and the expectation that they have of a vaccination. So I didn't think I never, but that's why it's important to talk to people.
Right.
This is reach talk. We have to reach one another to find out what are the positions of our community members. I don't have it all. Stan doesn't have it all. And, we sit and work with probably 40 to 50 different people. We don't have all of the answers. Mm-hmm. And they said, well, if you say it's a shot, it's just a shot. a vaccination means I have 100% protection. So there are people in our community that believe if it's a vaccination, it should protect me 100%. Here's the truth of the matter. There is no 100%. There is a high rate, or if you do get COVID, you won't have, what's the term? It won't be as aggressive.
Right.
The outcomes, you could avoid hospitalization. So some people say, well, why take it if it's not going to be 100%? Now you're thinking, really? But there's all these other vaccinations that we have been accustomed to taking outside of the flu, before we send our kids to school. They can't go to school until they're what? Vaccinated, right? Against things that actually loss of life. So polio, people were dying of polio, right? So they were dying of measles and all of those things that they created, the CDC, the FDA, all of those governmental, and everyone that does all of that scientific work to give us some protection, created for us to not address those things. Like I laughed and I shared, well, I'll share with you, I was sharing with my children. They do not know the pain of the chicken pox.
Oh my goodness. Oh my goodness.
They do not know the pain of the measles.
Mm-hmm.
They were vaccinated against it. So they don't know the agony of having the chicken pox. So, and here's the thing. There will be people that will not know. Now, we've lived in a period of time that was pandemic time for almost 18 months, for the most part, where we seen what COVID-19 did to the world. But what we also seen is how it did our Black and brown brethren and sisters.
Right.
How, because we have pre-existing and other additional comorbidities, we were not prepared. So Stan, can you just share for some people, they don't, they know, but they don't know because it didn't get to their door, or they didn't quite see the smoke, so there's some things that people have to deal with because it ends up in their living room. And then there's others that say, hey, I kind of hear the siren, but it's not really that loud. Can we discuss what were some of the data of the loss of life? I mean, globally, but in the US, but also locally.
Yeah, I think that's a great question, and I want to say first and foremost, if you or a family member or someone close to you, been directly impacted, by COVID, certainly, our thoughts, our condolences, are go out to you and are with you. And when we look at here, locally, in our community, and I'm gonna say maybe even in others, that when it comes to COVID, we're twice as likely, we're African Americans, Black people, all right, or who identify with the Black diaspora, we're twice as likely to get it and 3 times as likely to die from it. That's reality. That's the numbers, that really stick with me, and when we look at that, how many of us are, essential workers, how many of us are, we can't, we're taking care of other people, we're taking care of our families, and then when we go into those environments and we don't have any protection, zero protection, then we're not only putting ourselves in harm's way, but we put in our family members, our friends, and our community. So we certainly want to highlight and recognize the fact that everyone has a choice, everyone has a decision, and also everyone has a responsibility, to their fellow man, brothers and sisters, as well. And with that being said, what Ebony, what we've been trying to do, we know that information don't change behavior, alone. That the environment itself, has to change. So what we've been trying to remove those barriers by bringing, the vaccine itself. Once again, awareness, education, and increasing access, for those who are ready, to be to take the shot or to get vaccinated, so that they have, that resource readily available to them. So, dealing with that 23 number, twice as likely to get it, 3 times as more likely to die from it. It's very important that we collectively, remove these barriers. That's, to me, that's the biggest number. Even if it's one person at a time, one zip code at a time. Look at what's happening in the 14211 area. We have the largest disparity in terms of people between the ages of, I believe, 18 to 34 or what have you, that are unvaccinated. And that's an issue. That's a issue not only for those who aren't vaccinated or who are unvaccinated, but also for others as well. So we're trying to do what we can do to bridge that gap.
For sure. So specifically in the 14211 area, I think it's only about 34%, right, is actually vaccinated in the 14211. When for herd immunity, if you will, was 70. So you're talking half of what we were trying to achieve as a community to at least get to 70%. But here's the thing. People that live in 14211 just don't move in 14211. You understand? So when that number being so low, when everyone migrates and go from place to place, that changes who you're around every day, whether it's your grocery store, your church, so you could be in when you can have a really good number in one particular zip code and say, hey, they're 70% vaccinated. But when we get together, it changes the numbers, right? And then you discuss like the loss of life with COVID-19. So with all the other social determinants of health that impact us and all of the other comorbidities that impact us, we all already have reports that our lives are already shortened by probably about 15 years.
Absolutely.
Because we're more likely to have diabetes. We're more likely to have heart disease. We're more likely. And this is how they're tracking our behavior. And I'll share with you, I remember one day sitting and we were doing, people were doing some data reports, and you're thinking, wow, people can track that someone that looks like me, lives where I live, speaks my language, may do what I do, and we're all going to die. The possibility of that I could die 15 years less than, someone can outlive me that lives in a different place and of a different race. That blew my mind.
Right.
That when I went out in the community, I'm like, do you know, based upon how you behave today in the direction that you're going, they almost have a date. Spiritual folks say no man knows the time or day when they will leave. So
Right.
I'm sitting in a room and saying that people that look like us, you'll probably check out of here in 15 years because you live this way.
Right.
How we address stress. So I'm excited about being able to be with everyone and just talk about all of this, just break it down like an onion, because there's so many layers to what impacts us, our lives. We have such resilience, we have such diversity, but we need to talk it out. We have to come and have those hard conversations with each other, right? We don't have all the answers, but together we can get an answer. So that's important.
And I love what you what you just shared, Ebony, because we got to stay woke. We got to stay woke. Seriously. And the fact, like you just said, where you live should not be. I'm gonna say where you live, where you work, where you play, where you pray. That zip code should not be a death sentence. That should be a jubilation. And what Reach is about really celebrating life. It's about celebrating, and promoting, the beauty of our culture, the resilience of our culture, of our heritage, the liberation. We just celebrated, Juneteenth. You know what I'm saying? It wasn't about one day.
Right.
This is a way of life.
Right.
So I'm with you. I'm excited.
I am. I am. Honestly, I am. I'm like, it's good I feel real personable, like this is a personal space that we can talk it all out and figure it out. We can, and before we close the show, there'll always be ways for you to see on WDAP how to contact us, and Twitch and the other platforms that you'll find our show bi-weekly. We want to hear from you. We want to know, are we going the right way? So we have phenomenal. And now here's the thing. I want to make sure you all know we don't do anything without running it by
There you go.
our community.
Exactly.
Okay. We don't do nothing. So I'm going to let Stan tell you about these phenomenal CWCs. And I have a bomb community group that I work with. And, I'm fine with it growing. The more we get it done. So talk about the CWCs.
Sure.
Too.
I tell you, Ebony, this is our first show and we vibing because this is the voice of the community right here.
Right.
Right here. And as Ebony said, we don't do anything without, really consulting and having conversations with the community. When you see the Reach logo, when you see the arm, the red, the black, and the green, and the gold, that's embedded, in our logo. That logo, that the name came from the community itself. And sometimes, like in our conversations, our community wellness champions, they said, nah, that's not it. Nah, that won't work. We had to go back to the drawing board. And finally we came back, to the table one day and they said, yeah, that's it. That's that it factor. Yeah, that's the logo. Right. That's the color. That's the impact that they want to see and have on the community. So whether it's, working in tobacco control, or whether or not it's doing some media and some marketing, the development of other materials, our community wellness champions, they see everything. They participate in listening sessions. They have their own tablets, whereas though they take surveys or participate in other ways that they provide feedback, to us and information and conversations with us, either through formal meetings and informal conversations that help us to design, and implement, different activities and events, fun activities and events, I should say, community activities and events moving forward. So in addition to that, we have a tobacco action group tag team that's comprised of 6 other residents from the community. They're actively involved. Both groups meet on a bi-weekly basis, or bi-monthly, I should say, on a bi-monthly basis. So, there's opportunities for you all, our listeners, our audience, to get involved at different levels, different levels of engagement, as I like to say, so certainly if you want to get involved, you can, I'm just going to put this out there right now. You can email me, at smartin, SMARTIN, at caiglobal.org. Once again, that's smartin at caiglobal.org. And I can then follow up with you with the appropriate person, contact person, who can address your questions if I can address them or assist.
Awesome. So, so Stan, I'm gonna put this request out here, right? So we've had billboards, we've been in newspaper, we've been on radio, we've been on television. I would love for us to, if you are a Reach listener, you're following what we're doing, we're following our work, maybe we should have some lawn, what do you call them? Lawn, you know what I'm talking about.
The lawn posters,
Right. Because I want you to know that Reach, and sometimes you see things, but I think people are growing accustomed that they hear Reach and they know what Reach actually means. So the beautiful part about Reach being an acronym, but Reach means exactly what this work is about. Yes, it was put together, racial and ethical approaches to community health. But Reach is about one hand linking with the next, and we're reaching each other. We're not skipping over anybody. We have to do it together. So that is significant. So I want to see Reach everywhere. I want to see them on the side of your car to say, I'm a part of Reach, right? Listen, so the same way with the tobacco sensation, you might see some places that you cannot light up a cigarette.
Right.
Smoke free. I want people to say I'm a part of Reach, that I'm doing my part. So Stan and myself and all of the rest of our partners, we can't do this work without you. We just absolutely cannot do it. I need grandma to be talking about, you know what? I want to go to that diabetes class. Let us go together. I'll speak for myself. I love when, when I lead classes and it's a family. On one hand, somebody will say, man, all of them have diabetes, but I'm thinking about what they're doing for themselves.
Right.
How they want to self-manage, how they want to improve their health, how they want to share some new ways how to address things, our relationships with food, our relationships, how we deal with stress, everything, the things that we can control. So I'm excited about all of that,
Right.
So Stan, I did just make a request. I didn't email it. I just did it live. But
cool.
I think we'll get there. We're gonna get there.
Yeah, no, I'm with you, and I'm gonna follow up on what you just shared, and that is, you know what, we want you all to be involved and be engaged. And if you don't take away anything from me, this during this time together, nothing about you without you. Let that marinate. Nothing about you without you. Okay, so please, that's what Ebony and I are encouraging. We're reaching across, saying the aisle, across the grass, across the stream,
right, all of it,
airways, the internet to you.
Right, and even when we're in disagreement, this is what I express to people. Even if we don't have the same views, I respect you and you respect me, but I want to make sure you have a next step, a next plan of what you're going to do, right? So I'm still going to be a resource. I'm not going to change. I do community work, so some may have seen me out in different places. Oh, I have been chewed up, chewed out. But when it's all said and done, we all family. Listen, I'll see you later next time. Maybe you'll change your mind. But I think we can still have opposing views, and I'm still not going to do the work without you because you're important. You understand? So that's the awesome thing. So I kind of want to, before we close up our segment, wow, this has been great.
All right.
I'm going to be super excited when Samantha joins us and all of our guests because we have so many friends and partners out here. I want to share an opportunity that you can really be a part and come and see me, actually. So on July 16th, I will be at Price Choppers, 1580 Genesee. Price Choppers, you just got a plug for letting me be out there. On that day, we're going to be strictly education. I'm going to give you info. We're going to have some linkage, and we'll also be doing some community needs assessments on that day. Stop by, say hi, just let's talk, because I believe it's important that we educate our community. We have a lot of different access points for COVID-19 for vaccination, and we'll have an upcoming calendar. And then there's also July 17th, the next day, will be with Senator Kennedy as well in the Community Health Center of Buffalo. They'll also be doing vaccinations at that time too, and they'll actually be serving lunch. So on July 16th, meet me 11 to 1 at Price Choppers, 1580 Genesee. Then the next day, July 17th, if you missed me on Friday, 12 to 4. I might not be there until 4, but if you get there on time during lunch, you catch me from 12 to 2. But my friends will be there as well to do the same thing. I want you to be educated. I want you to make the very best choice for yourself and for your family at large. And overall, when you make those good choices, you make a good choice for us as a community. I no longer want data to report how long I will live or how long you will live. How about you, Stan? Final thoughts?
No, I think you summed it up. Really, definitely. Like I said, nothing about you, without you. So please get involved. There's many opportunities, to lean in.
Right.
To get active. So thank you so much. And I appreciate and applaud you, Ebony, for your resilience and just all that you've done for this community and the hard work that you do on a day in day out basis.
I can't do it without a phenomenal team that keeps me going, keeps me motivated, keeps me encouraged, right? And I'm hoping that I'm encouraging somebody else that they will jump on and understand that they all have an important part to play. Stan is the man. I'm going to be honest. Everybody's always looking for Stan. You know, if you got a question, you
Thank
got to
you.
go to Stan, and Stan never withholds any information. And that is awesome, right? Who wouldn't want to be a part of a team like that, right? So I look forward to being with you in the next couple of weeks. Check us out. I know this will if you want to catch us on the rewind, or you just stop by, check out our Facebook pages. We are there. We're on Instagram. We're always sharing up and coming spots where you can find us, and hope to see you then. Until then, be well as we continue to reach one another, one person at a time. Thank you.
All right. Thank you.
Reach Buffalo, promoting a healthy community. Reach, racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator, at 716-268-2954.